Oxybutynin Patch, Transdermal Semiweekly is used to treat an overactive bladder. It works by relaxing the muscles in the bladder, which helps improve symptoms such as the inability to control urination, incontinence, feeling the need to urinate urgently, and having to go to the bathroom often. This medication belongs to the class of drugs known as antispasmodics. It is not recommended for use in children younger than 5 years of age. It is important to consult your doctor for more information. Unless otherwise directed by your doctor, the over-the-counter product should only be used by adult women who have symptoms of overactive bladder for at least 2 months. It is also important to carefully read the package instructions before using the over-the-counter product to ensure it is the right product for you. Check the ingredients on the label, as the manufacturer may have changed the ingredients, and products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. The optimal timing for using the Oxybutynin Patch, Transdermal Semiweekly should be determined by your doctor, and the daily dosage should be followed as directed by your healthcare provider. When using the Oxybutynin Patch, it's important to follow the instructions carefully. If you're using the over-the-counter product, make sure to read all the directions on the package before applying the patch. If your doctor has prescribed this medication, be sure to read the patient information leaflet from your pharmacist before starting to use the patch. The patch should be applied to the skin as directed by your doctor, usually every 3 to 4 days. If you're self-treating, apply one patch to your skin every 4 days. Be sure to remove the old patch before applying a new one, and apply the new patch to a different area of the skin to prevent irritation. Before applying the patch, wash the area with soap and water, and dry it thoroughly with a clean towel. Apply the patch to clean, dry, and smooth skin on the abdomen, hips, or buttocks, and press firmly to ensure it stays on. Avoid applying the patch to areas of oily, red, cut, or irritated skin. If the area around the patch becomes red, itchy, or irritated, try a new site. If irritation continues or becomes worse, tell your doctor promptly. When it's time to apply a new patch, remove the old one and dispose of it properly in the trash. Use this medication regularly to get the most benefit from it, and do not increase your dose or use this drug more often or for longer than prescribed. Be sure to inform your doctor if your condition doesn't improve or gets worse. If you're self-treating, tell your doctor if your condition does not improve after 2 weeks. And if you think you may have a serious medical problem, seek medical help right away. Some common side effects of the Oxybutynin Patch, Transdermal Semiweekly may include skin redness, itching, or irritation at the application site, dry mouth, drowsiness, dizziness, blurred vision, headache, weakness, nausea, or constipation. To relieve dry mouth, you can suck on sugarless hard candy, chew sugarless gum, drink water, or use a saliva substitute. To prevent constipation, try eating dietary fiber, drinking enough water, and exercising. Your doctor may also recommend a laxative. Remember, your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. Be sure to tell your doctor right away if you experience any serious side effects, such as vision problems, difficulty urinating, signs of kidney infection, fast or irregular heartbeat, mental/mood changes, fever, flushed/hot/dry skin, or signs of stomach/intestinal blockage. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. And remember, this is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects not listed. Before using Oxybutynin, make sure to tell your doctor if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to talk to your pharmacist for more details. Before using this medication, it's crucial to inform your doctor about your medical history, especially if you have certain bladder problems, glaucoma, liver disease, high blood pressure, heart problems, stomach/intestinal disease, kidney disease, dementia, enlarged prostate, overactive thyroid, or Parkinson's disease. Additionally, before self-treating with this medication, tell your doctor if you have signs of a bladder/kidney infection or signs of diabetes. This medication may cause dizziness, drowsiness, or blurred vision, so it's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do it safely. It's also important to limit alcoholic beverages and avoid overheating, as this medication may make you sweat less and increase the risk of heat stroke. Before having surgery, inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are going to have an MRI test, inform the testing personnel that you are using this patch, as some patches may contain metals that can cause serious burns during an MRI. Older adults may be more sensitive to the side effects of this drug, especially drowsiness, confusion, constipation, and trouble urinating. It's important to be cautious, as drowsiness and confusion can increase the risk of falling. During pregnancy, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also unknown if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when using the Oxybutynin Patch, Transdermal Semiweekly. It's possible that other medications or products could affect how this patch works or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not make any changes to your medication without consulting your doctor. Some products that may interact with the Oxybutynin Patch, Transdermal Semiweekly include pramlintide, drugs that can irritate the esophagus/stomach, opioid pain or cough relievers, alcohol, marijuana, cannabis, drugs for sleep or anxiety, muscle relaxants, and antihistamines. It's important to inform your doctor or pharmacist if you are using any of these products. Additionally, it's important to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that can cause drowsiness, constipation, or blurred vision. If you have any concerns, be sure to ask your pharmacist about using those products safely. This patch should not be chewed or swallowed, as it can be harmful. If someone has overdosed, remove the patch if possible. For serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. If you are in the US, you can call your local poison control center at 1-800-222-1222. If you are in Canada, you can call a provincial poison control center. Symptoms of overdose may include unusual excitement, agitation, and fast or irregular heartbeat. Always use this medication as prescribed by your doctor and follow their instructions carefully. It is important to talk to your doctor about the best time to apply the patch and the correct dosage for you. If your doctor has recommended the Oxybutynin Patch, Transdermal Semiweekly for you, it's important not to share it with others. It's also important to keep all your medical and lab appointments. This medication is used to treat an overactive bladder. It helps to control frequent urination and sudden urges to urinate. You should apply the patch to clean, dry, and hairless skin on your stomach, hips, or buttocks. Change the patch twice a week, such as every 3 to 4 days. Apply a new patch on the same day of the week at around the same time of day. Apply the patch at around the same time every day. If you forget to change the patch on the right day, just remove the old patch and apply a new one as soon as you remember. Make sure to stick to your original schedule for changing the patch. Don't take extra to make up for it. When storing the Oxybutynin Patch, Transdermal Semiweekly, make sure to keep it at room temperature in its original sealed pouch, away from heat, light, and moisture. It's important to note that different brands of this medication may have different storage requirements, so be sure to check the product package for specific instructions, or ask your pharmacist for guidance. And as with all medications, keep them out of reach of children and pets. When it comes to disposing of the patch, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.